Seeking healthcare in Ghana is difficult at any time. And for families that look after elderly folks, it's even more challenging. And this is because of the long queues that they have to endure, the high cost of care, and the difficulty in finding the right kind of person who will look after your elderly father or mother. My name is Dr. Kobia Piasichi. I'm a consultant gynecologist. I used to live and work in Manchester as a consultant in the Royal Oldham Hospital in Manchester. I'm now in Ghana and I'm the CEO of Ghinger Healthcare. Ghinger started in 2016 and Ginger's main focus has helping folk who live abroad to look after their parents right here in Ghana. In 2010, I was in the United Kingdom and my dad was in Ghana quite unwell with a heart problem. And even as a doctor, it was quite difficult for me to find specialists to look after him. So in 2016, we set up Ghinger as a company to solve this problem on behalf of Ghanaians in the diaspora who had elderly folks at home. Now, Ginger's main work is twofold. One, they provide telemedicine services for people that are sick. And two, they provide in-house care for those who also need it.
So my name is Dr. Isaac J.K. Baini. We're head of clinical services at Britannia Medical Center. And also I'm the acting head of operations with Ghinger. When it comes to our operations at Ghinger, basically we have two arms of business where we do physical home visit care and then where we also have telemedicine. With regards to the home visit care, you have all the cadre of healthcare staff visiting you to take care of you. So from doctors, from nurses, physiotherapists, psychologists, all the cadre of healthcare staff that you can think about. Depending on the condition, we will deploy them to come and take care of you from the comfort of your home or offices. With regards to our telemedicine services, we're basically saying that distance is no longer a barrier to seeking help. Your loved ones can actually have connections to top medical experts to attend to them through secured video phone consultations for the comfort of their homes and offices. With that, you get your diagnosis done, we send you your medications and the need for follow-ups all done virtually.
My name is Kwaku Oforiansa. I'm a retired professor from Howard University, Professor Emeritus, and I was born in Ghana some years back. And I went to the US and lived there for 45 years, teaching and learning. And I decided to retire and come back home. Generally, when you are in the US, you think when you come back to Ghana, you will not get good medical service. But we were wrong. We realized that Ghana has changed, especially when we meet medical groups like Ghinger and Dr. Sachi, who is a real human being. Then you know that, yes, you're back home. So we have received a lot of good attention from Dr. Sachi as a person and also as a doctor. And we're very much impressed by the professional attitude and also the technical aspects of the delivery and the personal aspect as well. So we'll fully recommend my friends in the US who want to come home but probably are not quite sure that they will get good medical attention. Come home. You meet people, doctors like Dr. Sachi and the Ghinger Group. They will give you good, top-notch medical attention, just like we get it in the US.
So Ghinger has three main packages it delivers. So the first one is what we call the Ghinger Premier Service. The next one is the Diaspora Health Cover. And the third one is the Ghinger Saver Package. Now the Ghinger Premier Service is compassionate care tailored to the family's need. So if you basically have a particular need, you need a nurse, you need a doctor, you need a physiotherapist, you make a request with Ghinger and we go and deliver that specific need. It's basically a pay-as-you-go service that addresses the need that the family has at any point in time. The second package is our diaspora health cover, which works a little similar to an insurance cover. Basically, this package requires for you to pay quarterly subscriptions into an account, and then it covers your relative for 24/7 access to doctors, 1,000 Ghana cedis of lab cover per year, 1,000 Ghana cedis of medication cover per year for your relative. And then they get admission support, which basically means that if they go up into the hospital on admission, Ghinger pays part of the admission bill for them. So that is the diaspora health cover. Our third package is what we call the Ghinger Saver package. The Ghinger Saver package is a very useful package because it's similar to the diaspora health cover, except that while you are paying your quarterly subscriptions, you can also pay small amounts of between 10 and 50 pounds monthly that goes into a savings account separate for you. So that in the event where the care of the beneficiary who is sick supersedes what is provided in the cover, you are able to draw on these savings to be able to pay the extra bill, and you don't have to send money from the United Kingdom. So the care that Ghinger is able to deliver today wasn't available to me when I lived in the UK. But Ghinger has been set up as a company to be able to help Ghanaians in the diaspora solve this problem of caring for their family back here at home. All you need to do is call Ghinger, and then Ghinger will not just support them, but take them through all the healthcare processes till your relative gets better.